Money Matters TV. I'm Mike Dever, the founder and CEO of Brandywine Asset Management. We're an investment firm that develops products that allow investors to invest in stocks, but with downside protection. I'd like now to introduce my co-host, Audrey Greenberg of Discovery Labs and Center for Breakthrough Medicines. Hello, Audrey.
Hi, Mike. Thanks for having me. It's so nice to be here.
That's great. Great being back from the summer. Want to talk a little bit. I mean, we've had some discussions, but you've got a really interesting business going. Can you give us a little introduction?
Yeah, thanks for the opportunity. So the Discovery Labs is a 2.4 million square foot life science park in King of Prussia, Pennsylvania. We have one of the largest biotech clusters in the United States with our expansion to 10 million square feet in the next couple of years. Housed on our site is the Center for Breakthrough Medicines, which is a cell and gene therapy contract development and manufacturing organization that's based here in King of Prussia, Pennsylvania at the Discovery Labs. The purpose of the entire organization, including both the Discovery Labs and the Center for Breakthrough Medicines, is to expedite cures to patients that need them. Cell and gene therapy is on the cutting edge of medicine. It's curative rather than just a treatment. And it's really exciting to be part of this Philadelphia cell and gene therapy cluster.
Yeah, that sounds great. Now, what is your involvement with it specifically? What's your day-to-day role you're participating in it?
Yeah, well, I started the company about 2.5 years ago with Brian O'Neill. We've now onboarded over close to 80 professionals, and we're continuing to hire. So if you're looking for a job, breakthroughmeds.com or discoverylabs.com. We'd love new team members. We're hiring across the board. So my involvement is really just that, expanding the team, working on joint venture partnerships, working on strategic collaborations, working on our capital structure. I'm very involved in some of the key components that our cluster needs, which is really tech transfer and tech translation out of universities. And so working with some of the universities and some of those that are developing innovative treatments and helping them to commercialize those products.
What can you talk about any of the products that are being developed that you're witnessing?
Yeah, I can't at the moment, but we should be able to soon. So we're under strict confidentiality, but in the next couple months, as things come closer to the finishing stages, we will be more than pleased to announce those on the show or otherwise. But just know that we're working with the brightest and best minds in the business that are really some of the founders of cell and gene therapy.
Wow, that's impressive. Now, do you see in the future, are we moving into more cell genetics rather than chemicals and drugs?
I think so. We're going to precision medicine. So now that we're able to efficiently map someone's genetic code and understand what diseases are being caused by certain genetic issues, you're able to identify a specific gene and then possibly repair or replace that gene that's either not expressing a certain protein or expressing too much protein. And you're able to do that through several modalities. We're familiar now with mRNA, but there's also viral vectors, which are used in gene therapy for genetic disease. And then in cell therapy, you're able to take someone's T cells, which are the cells responsible for attacking their cancer, genetically modify those T cells so that they don't exhaust and that they're more efficient to kill cancer. And we've seen several lives being saved through T cell therapy. And that's continuing to now go from blood cancer to other cancers. So it's exciting when you're able to attack tumors with similar technology. So you're going to see more and more of that. We're just at the beginning right now.
And right, and it was going to be my next question is how close are we to actually seeing some therapies in practice, not just in trials or in tests, for people to be able to use?
Yeah, so there are many approved products right now, but they are for a lot of rare diseases. So the reason that is you get more expeditious treatment with the FDA when you're treating a rare disease. But as those technologies are proven, and they're continuing to be proven, in the last year, there's been several new approvals with the FDA. We're talking about several commercialized products, but no more than 10 at the moment. But as we've got 20 expected approvals per year with the FDA through 2025. So there's a lot of vector hungry customers out there looking for capacity and looking for ways to get their products made and get their products to the masses, not just for rare disease, but for wider spread indications like diabetes, Alzheimer's, hemophilia, heart disease. And so I expect in the next 5 to 10 years, you're seeing more widespread indications being treated by this technology.
Now, we had someone on a prior show who's some Alzheimer's trials. Do you see that as something that can be stopped, reversed, prevented? What can gene
all the above
do with that? Is that
yeah
right?
all the above. You can regenerate tissue that's been damaged in the brain. You can stop the process from happening and repair the damage that's been done. And keep in mind, though, there's many different kinds of Alzheimer's, and so to the extent that we're able to do it for a certain type, it may apply to other types. But as we continue to make progress in this area, you're going to see a lot of exciting announcements.
And where does the United States stand in the world stage compared to some of the other countries?
Oh, we're in a great position. We have tremendous attention to the life sciences sector, especially in light of COVID. It's really shined a light on life science and pharma and biotechnology, especially with mRNA. A lot of that technology came out of University of Pennsylvania, right in our backyard here in Philadelphia. But the United States is really at the cutting edge. A lot of the technology was developed not just in the United States, but in Philadelphia. So Jim Wilson, who is the inventor of AAV gene therapy, and Carl June, who's the inventor of CAR T cell therapy, are both at University of Pennsylvania. Spark Therapeutics, which had the first approved gene therapy in Luxturna, which is a cure for a certain form of inherited blindness, that was born out of Children's Hospital Philadelphia. So it's not just the United States, but it's really Philadelphia that's on the cutting edge.
Are you seeing a lot of the therapies and a lot of the development coming out of universities? Are there private labs, competing as well, or is it more academic based?
Yeah, it's all academic based at this moment. So a lot of the innovations are nascent. They take place in academic labs. And while the therapies prove to be effective, they're very hard to scale up and manufacture. And that's why they partner with a company like the Center for Breakthrough Medicines at Discovery Labs, is really to help them develop and manufacture their therapy. So we take these nascent therapies that are developed in these academic labs and make them into robust, manufacturable, repeatable processes so that they can more efficiently get approved by the FDA.
Okay, well, that's great. We have a viewer question. Let me pull it up here. Okay, so this is from Thomas Waldron out of Philadelphia. What are some of the needs for new biotech companies?
That is a great question. Thanks, Tom. So a lot in terms of Philadelphia specifically, we have a need for more lab space and more services. There's really a lack of lab space, not just in Philadelphia, but it's a global phenomenon right now just because of the increased attention to biotech in the last couple of years. We're seeing all-time highs in terms of capital raise, IPOs, M&A, private market transactions, venture capital. It's all at all-time highs. And with that money comes spend on lab space. And we're just seeing a lack of it, not just in Philadelphia, but like I said, everywhere. So we need more lab space. We need better tech transfer and tech translation services out of the academic institutions. Really importantly, we need incubator space. So while we need lab space for companies that maybe need 10 to 15,000 square feet up to 150,000 square feet and above, we also need incubator space for startup companies that maybe just need a bench in an office or maybe need a handful of labs. So it's important to provide a spectrum and a continuum of space and of capital. Philadelphia has been importing a lot of its capital, which I don't see as a big issue, but it is nice to support homegrown success stories. So I would say capital, lab space, services, incubator space, and really the infrastructure that can take a product all the way from idea to commercialization.
That's great. Well, thank you very much, Audrey. what you're doing is great. I'm excited to see how it develops, because it does seem like there's so much opportunity in what you can do to improve health with your approach. Okay, so here's how you can send in your questions if you'd like to ask questions to Money Matters TV.
You can have your questions answered on Money Matters. Please go to our website, money-matterstv.com. On our homepage, click on the banner on the right that says, Send us your questions. While you're on our website, you can find information about our host and guests, as well as show notes and links about this show and past shows. Money Matters is also available as a podcast on iTunes and Stitcher, so you can listen to Money Matters while you're on the go. That website address, again, is money, MONEY, -matters, MATTERS, TV.com.
Welcome back to Money Matters TV. I'm Mike Dever, the founder and CEO of Brandywine Asset Management. I'm now going to introduce our guest, Kristina Markiewicz of Blackwell Capital Partners. Hello, Kristina.
Hey, Mike. Glad to be here. Thanks for having me.
Yeah, absolutely. It's great having you here. Now, I hear you have a unique market kind of focus in your practice. And you tell us a little bit what Blackwell Capital Partners is first, and then specifically what your role is there.
So Blackwell Capital Partners is a general agency of One America Securities and also life insurances. And my role is I'm a registered representative, and my specific passion within that role is really helping special needs families excel their financial goals from infancy all the way through adulthood. And as well, helping charitable organizations really excel their profitability and what they're able to offer the communities that they serve.
So are you actually then working with a lot of the charitable organizations directly to send people your way that you can help?
I do.
Work with the organization itself?
I actually both.
Okay.
I'm actually a board member of the Autism Society of Greater Cincinnati here. And that really roots from myself being a special needs parent. I have 2 kids, and my son is on the autism spectrum. And, that's really me giving back to the community is super important, as, being part of that member of the Autism Society, but as well, really making sure that these, charitable organizations have financial health. As we'll, talk maybe probably later in the conversation, that, during the pandemic, a lot of financial things were happening to these organizations that they were unable to really sustain through the pandemic.
Okay. I think, Audrey, you had some questions.
Yeah, what are some of the mistakes or pitfalls or things that parents or caregivers of special need kids should be aware of? What should they be paying attention to?
Yeah, it's a great question. Like I said, I'm a parent myself, and so I've been guilty of some of these things. I think most parents, they're always putting their kids first. And unfortunately, when it comes to financial matters, sometimes that is a mistake. And what I'm seeing in my practice, especially with special needs families, is that, many families are putting off making financial decisions to help themselves or their children until their children are of 18 or even past that, maybe even 22, when they're out of the educational system. And that's really a big mistake, because, many parents are losing the opportunity to have, compound interest happen, as far as being able to save and grow their retirement accounts or any other funds that they need to save for their children. And as well, insurability risks, if they are in need of insuring themselves. Many times that, it's becoming out of reach, as far as financially, or maybe they're just not as healthy enough to be able to get those insurances that they're going to need long term.
You talk about saving. What is it that the parents can do to help the savings for their special needs children, and help the children save? And do most of these have incomes to help save?
Yeah, so I talk about this a lot with my families. One of the main things that people can do is, if they have a special needs child with a disability, One of the things that's come out of recent is the ABLE accounts. Back in 2014, this is the Achieving a Better Life Experience. That's what the ABLE acronym stands for. And it really helps create a strategy for the special needs individual with a disability to be able to save money past what they typically could. Before the ABLE accounts were started in 2014, somebody with a disability was unable to save more than $2,000 before they would be kicked out of any sort of social program of public assistance. Because most public assistance is a means test, and when you have a disability, you need any public assistance. That means test is brought into play. And so what this ABLE account is creating an ability for the person with the disability to create a savings plan and an investment plan for them to save past that $2,000 and have, tax advantages to that program.
When you're saying, is it 2,000 per year, you're saying?
Well, the $2,000 is an aggregate actually. So the 2,000, if they have more than $2,000 in any sort of savings account, checking account, any personal account that has their name on it, that's what I'm talking about. And it's an aggregate, and it's not just per year, it's in totality. So the ABLE account prevents that $2,000 from being the only thing that they can have in their name.
Interesting. And are there other accounts other than ABLE that they would have access to in terms of being able to save or invest? And then how do you get access to that?
So the ABLE accounts is probably the best tool because nothing's preventing anybody with a disability of opening up a checking account or savings account. The bigger problem comes into play is when and if they need to have any sort of public assistance and those means tests come into play. The stable account, I call it the stable account because here in Ohio it's called stable. Every state has its own savings program, or most states have their own savings program of the ABLE accounts. And so, these ABLE accounts really provide just tremendous amount of support as well as just functionality. Here in Ohio, the stable account, it actually has the ability to have even a debit card attached to it. So it really gives the flexibility to the person with a disability to use it just like they would, a savings or checking account.
Mm-hmm. And how do you get access to the account? How do you apply for it and get access?
So great question. Like I said, the ABLE accounts is kind of just a federally mandated product that's out there. Each state has its own run program. And so how you would look at for example, the stable account in Ohio, they actually have their own program through the treasurer's office that you can just log into. I believe it's stable account, I want to say .gov. But you can log in and then you would just fill in your information about the person with the disability. And that's pretty much how you do it. And honestly, it only takes about 30 minutes.
And what can they invest in those accounts? Is it similar to an IRA account? Or?
It is similar to an IRA. It's actually more similar to a 529 plan. They're very synonymous. They are run almost identically. So if you are familiar with a 529 plan for another child, very, very similar, except that the stable accounts go above and beyond really what a 529 plan would do. For the stable accounts, they have the ability to allow for that individual to withdraw the money for medical expenses, clothing expenses, food expenses, shelter, and education as well. Versus a 529 plan is really just geared towards education expenses. So that's kind of the difference between them. And it really gives a lot more flexibility to the person with disability.
Yeah, for people with disability, is it important to have a trust structure set up to protect them as well? Or can this ABLE account handle everything they need for future needs?
That's a great question. I get this a lot of questions about this, just because I think, there's a perception that trusts are a bit pricey to set up for your family, and can these actually take over, one kind of be better than the other? And really my answer is that they really should work in conjunction with each other, and they work well in conjunction with each other. For a trust, it's really important to remember that having a trust available to capture any sort of retirement accounts that somebody may leave a child, or a life insurance policy that somebody might leave a child, or any sort of funds that are significant enough, especially anything that's over $2,000, because that same rule will come into play when any sort of inheritance happens or is passed down to an individual with a disability. And so how these can work together is that the trust can house maybe the majority of the funds, and can actually push money towards the ABLE account, and then that individual can then use the ABLE account for the withdrawal of that funds to be able to use for whatever expenses that they're needing at that time.
So is there any other strategies that parents or caregivers should think about employing personally as a financial planning measure? I have 3 young kids. I'm busy. I barely have time to manage my money. I can imagine having a special needs child. It just, like you were saying earlier, puts a lot of things on the back burner. What should the parents of special needs and caregivers of special needs kids be thinking about for financial planning?
Sure. Yeah. What I would first say is think about yourself. Because I use this analogy a lot, but I think that it really helps people understand what the importance is. And that is that, when you are on an airplane and they are giving you the rules before they take off, that, if there's an oxygen mask that drops down, what are you supposed to do first? You're supposed to put the oxygen mask on yourself before you help your neighbor. And the same rule applies to parents that are trying to help themselves and be prepared for their own retirement. Because if they're not helping themselves, they are not going to be ready to help their children. And so this really goes to starting to plan out the trust, start to really understand their retirement accounts. If there is a life insurance need there, then it needs to be taken care of. And as well as they're approaching retirement, even more so, really looking and understanding their Social Security benefits and the taxation of all the different types of funds that they have that are going to be supplying their retirement.
You talk about working with retirement or with nonprofits and charitable organizations, and what needs do they have that you provide for them?
Yeah, so during the pandemic, 1 out of 3 organizations, there were charitable organizations, they were in jeopardy of closing within 2 years, just because of funds being cut short. That study came from the Center of Disaster Philanthropy, and many of them, as they had to change their ways in how they were raising money. Because prior to the pandemic, I think a lot of people liked to be able to raise money that were in person and have gatherings that were, face to face. That obviously all changed, and very abruptly for a lot of organizations, and they really were unable to pivot that to that model. And so it's really my goal to really help them understand some alternative ways of being able to talk to their donors and really have some help of how else the donors can help them in the best way possible.
Yeah, what are some ways that we as individuals that are very philanthropic and support charitable institutions, what are some other ways that we can support them, maybe financially or any other ideas that you have?
Yeah, that's a great question. And this is something that, when I work with the organizations that I do, I think a lot of people, when they're thinking about doing any sort of donation, a lot of people think about, that one-time donation or that monthly donation that they do. They're not really thinking outside the box as far as what else can they do that's going to really support that organization long-term. And one thing that I like to talk to a lot of organizations about is, consider asking your donors if they have a life insurance policy that is a cash value policy. And if they have a policy that they're not currently have a plan or the need for, maybe somebody has picked up a policy, 20, 30 years ago, and maybe they're doing well financially, maybe they don't really need that policy anymore. if it's possible that, that person could potentially make the charitable organization the owner and the beneficiary of that policy by just changing some paperwork. And what that does for the charitable organization is it gives them the rights to be able to use any sort of cash value in that policy while the donor is still alive, which is great for the donor and the charitable organization, because then they both can see the good that's coming out of that type of money. And the other thing is that that would also give tax benefits to the donor if they're still making premium payments. Other things that people could think about is doing some sort of a qualified charitable distribution from an IRA, or even transferring some stock or mutual funds to their organization.
To kind of wrap it up a little bit then, it sounds like you handle all the financial side. You're really good at directing that. But let's say someone just got a diagnosis. Their child has some sort of disability. They're starting out to make plans, not just financial, but just in general, schooling. And are you a person they can come to kind of help send them in the right direction for the other experts they need to be talking with to help that child?
Absolutely. Absolutely. I mean, many times the conversations that I have with my clients really starts out in that way. People are calling and saying, hey, my son was just diagnosed. I'm really starting out. I don't even know where to start. I'm having trouble trying to talk to my friends or family about this situation. I've been there. I understand. And I've been around now long enough to know that there's some great connections and there's some great organizations to help with a lot of that. And I'm always happy to talk to anybody about what they're feeling, because that's the first step in the right direction of really getting help.
And is that something you can do to help people outside of Ohio, or is it pretty localized?
Absolutely. Absolutely. I mean, disabilities is not a state line thing. I mean, this is something that's affecting everybody everywhere. And I think just about everybody knows somebody that has, either has a disability or knows, has a child with a disability. I think it's something that people need to talk about more, and feel free to talk about more, to ask for help.
Well, thank you very much, Kristina. That's been very educational, and I think it's very helpful for a lot of people. Thank you, Audrey, for serving as host on the show here today with me. And our next guest will be Mickey McLaughlin of Sandtrap Advisors, LLC. And we'd like to thank you for watching Money Matters TV, where your money matters. Thank you.